With the smear that you explained, what are we actually looking for?
The sample is checked for human papillomavirus, which is what we call HPV. This can cause changes in the cells of the cervix, and this is what we're looking for.
What does it mean if your sample has HPV?
There's usually two results that you can get. One is that you do not have HPV, in which case you would just have your routine cervical screening and you would attend when you get the letter as normal. If HPV is found in your smear test, then we then look for any changes in the cells of the cervix from the sample that's been taken. If you're HPV positive, but there are no changes in the cells seen, then you are usually required to attend for screening again within a year. If you're HPV positive but there are changes in the cells, then you are often referred to a gynecologist for further examination. And that usually means a colposcopy. And a colposcopy is when we look at the cervix with like a microscope to get a closer look at the cervix and more information about what could be causing the changes.
How can a patient expect to get the results, and what kind of results can they get?
So usually there's 4 outcomes that the patient could be notified of in a letter. The first one is that they don't have HPV and therefore they just have routine screening and they'll be invited again in line with the screening program. Option number 2 would be that they have to repeat the smear in 3 months' time because it may have been difficult for the smear to be interpreted. It doesn't mean there's something wrong, it just means they need to redo the smear. Option number 3 is that you are HPV positive, but there are no changes in the cells, in which case we usually recommend doing the smear again in a year's time. Option number 4 is that you are HPV positive and there are changes in your cells, in which case you'll be invited to attend for a colposcopy.
If you receive your smear letter, make sure you contact your GP surgery and book in for your smear appointment. It is important that you book an appointment that's not during the time of your period, as it will make your test invalid. At the Brooke Surgery, when a patient does contact us for their smear, we send them a text message that allows them to access their appointment system and then book in at their leisure.